Hey, welcome back to the series. This is part 3 of a 3-part series regarding me helping you identify areas in your body based off of a movement screen that can be affecting your golf game. We're going to be looking at the hips and knees. So if you've already gone through the part 1 and part 2 and you made it to part 3, that means you still haven't been able to get lower into your squat, possibly because of the hip and knee problem. So here's where we're going to go through that deep overhead squat and identify if your hips are truly limited or if your knees are limiting your deep squat. If you have not seen the first or second part of this 3 video series, I'll go ahead and link it down in the description below. So you can go ahead and self-assess yourself and then follow along from there. But if not, you're at the right place, and this is going to be going over the hip and knee. So I've created a PDF for you guys. I'd love to send it to you. It's regarding the top 5 golf performance warm-up exercises that you can use before, during, and after you play. Go ahead and send me an email, which is in the link down below, and I'd be more than happy to send that your way. So since you're watching this video, this means that when you were doing the squat with your heels up on the pad, on a 1 to 2 inch pad or block, hands behind your head, and you squatted down, you stopped at some portion where your hips are above your knees, or kind of just like at your knees, but you weren't able to get lower than your knees, indicating that you have a hip or knee mobility problem. So because of these accommodations, meaning we take the upper body flexibility out of the problem and then the ankle limitation out of the problem, that leaves only 2 areas, your hips and your knees. So one simple screen to see if your knees are limiting you in this, and then we can isolate the hip, is can you bring your heel to your butt? Just like this. If your knee can bend more than 90 degrees or more than 100 degrees, the knee is not the issue. But you're gonna have to try to test both sides, obviously. If you're able to do that, your knee's not the issue. It would be a hip limitation. However, if you're not able to get your foot up there, then I'll show you another way how to assess your knee mobility. Okay, so now I'm going to show you how to evaluate or how to assess your knee flexibility. If you tried pulling your heel to your butt and you're not able to do it, then I'm going to show you a more detailed way on how to assess that and to see if your knee does have that range of motion it needs to get deeper in the squat. So what I'm going to use today is just a goniometer here, just so I can show you on camera reference or how much knee motion is actually being shown in the video. So you can have a better idea of, hey, am I there or am I not? It's questionable, not 100% sure, but you can mimic or you can pause my video and then compare it next to yours. So here's how you assess the knee range of motion. What you're gonna need is to put your foot up on a chair. Here we go. So here's my chair, and I'm gonna set up this. So what you're gonna do is basically you're gonna drive your knee forward and your hip down. So it's almost like you're squatting. So if you can see, my knee angle here is far more than 90 degrees, because 90 degrees would be more like this. So I'm going to show you specifically what 100 degrees looks like, 90 degrees, and all of that. So right here, that's 90 degrees. So you have a frame of reference. Now let's move into 100 degrees, which is there. That's 100 degrees of knee flexion. And that's all you really need to get your hips below your knees for the deep overhead squat. If you want to get fancy and if you can get to 110, maybe even 120, then as you can tell, my knee angle here is much greater and I should be able to get deeper into that squat. So that is how you assess your knee flexibility. Can you sit down and get your hip below your knee? It's very simple. If you are having knee pain or problems, and the pain is in the back side of your knee when you're doing this, I highly recommend being seen by a clinical professional, because they can do a detailed evaluation to find out, are you truly having a knee dysfunction, or if it's more just soft tissue related, or they can definitely help you out and figure that out. But if you're just having a stretching sensation over the front portion of your knee, that's expected. That would be a normal sensation you should be feeling when you're trying to stretch the knee joint. So that is how you assess in more detail the knee range of motion. For a treatment or for an exercise to improve knee flexion is you're gonna take a towel roll, roll it up like a burrito, put your foot up on a chair, place the towel behind the knee, And then you're just gonna work into the knee, applying pressure. So you're loading the joint and stretching it. Joints, when they are stiff and limiting motion, they like to be loaded. However, you have to do it to your tolerance. It doesn't mean go hard and aggressive right off the bat. You have to listen to your body and just work into that joint there. You're stretching it. Once you've done this for about 30 seconds, go ahead and retest. How far does your knee go? If you can get the hip below the knee, it doesn't seem like the knee is an issue in your deep overhead squat. And that means it would be time to look at the hip if you've passed everything else. So that's how you assess the knee range of motion or knee mobility. So I hope that was helpful. Let's move on to the hips. Okay, now that you already know how to assess the knee and whether it's a problem or not, let's move on to the hip. The hip in the deep squat, you're not getting below your knees, and that's a problem. So there's a few things that could be going on. You could be having tight muscles on the backside of your hip, not allowing you to get deeper in that squat position. Or the joint itself could be limiting you, meaning when you squat down, you're getting that pinching pain right in the front. If you're getting a pinching pain in the front, I highly recommend being assessed or evaluated by a clinical professional so that they can determine truly if it is a joint dysfunction and specifically treat you for that dysfunction. Because you can find tons of exercises online. However, being guided by a skilled clinician is the best option. So let's say that we ruled that out. You're not having that hip pinching pain in the front when you're lowering down, which means there is a group of deep hip rotators that can limit your ability to bring your knee up, or rather lower down into the squat. Now that I've shown you how to assess the deep overhead squat and find out that the hips are an issue, I'm going to take you through how to improve the hip flexibility as far as reducing muscle tension with using a foam roll. Then we'll get into some stretching and then finish off with a hip opener or hip mobility exercise. Let's first hop up on the foam roller and help improve that sensation of tightness or sensitivity in the muscles. Here we go. So you're going to grab your foam roller and you're going to sit on it. So because we're going to work the right hip, I'm going to put my right hand down, my right leg comes up and crossed, and I'm going to position myself so I sit on my right hip. And then I'm just going to roll back and forth right onto those muscles. I'm going to explore that entire backside of the hip there. If there's areas that are tender, sore, you may find an area, go ahead and just spend a little extra time working on that region. I can rock back and forth, I can go up and down, but nonetheless break down some of that tension that you may be feeling. The next area is going to be the side of the hip, which includes your glute minimus, medius, all of that. So you're going to straighten the right leg, you're going to bring your right elbow down, cross the left, lay on the roller on your side, and then you're just going to roll out the side of the hip. You can rock back and forth, exposing a little bit more of maybe the medius muscle or a little bit more of the maximus muscle, but you're just going to rock back and forth, up and down. Once you've done that for about a minute, you're going to slide the roller in, and then you're going to drop the knee trying to target the front corner portion of your hip. So it would be this front corner of my right hip, and I'm just going to roll right into that. Same thing, I'm just going to go back and forth, side to side. Applying that deep pressure to muscles helps improve the sensation of tightness or sensitivity. So go ahead and give it a shot. Use the foam roller, work on that area, improve the flexibility of the muscles. So the next step is to stretch, and that's going to be your crossover stretch. Also known as maybe a piriformis stretch, a glute stretch. It's to improve the rotary muscles in the back of your hip. So what you're going to do is you're going to sit in this position. You're going to cross your leg just like this. You're going to sit up nice and tall. Then what you're going to do is you're going to lean forward from your hips, not your low back. What I mean by that is you're going to sit up tall. You're going to lean forward from your hip, not your low back. You start bending from your low back, you're just going to feel a stretching sensation on the low back, but you're not going to be targeting the hip. If you find that stretch really isn't targeting the glute, you don't feel it a whole lot, What you're gonna do is you're gonna bring the knee up a little bit higher as you sit up nice and tall, and then lean forward from the hip. That should increase the intensity of that stretch. So what it looks like from the side view is you're gonna pull that knee up and then lean forward at the hip. You should be feeling the stretch right on the back side of your hip here. It's an easy way to target all of those rotary muscles in the back of your hip that could be limiting your ability to get deeper into the squat. If you're having a pinching pain in the front of the thigh as you're doing this stretch, that means you may have a hip joint limitation. So with that condition, I'd recommend being evaluated by your medical practitioners to evaluate and find out, hey, is that something that they can help you out with? If not, you can always come here and see me in the clinic. All right, so this exercise is a hip opener exercise. It's performed in the quadruped position, and it's designed to help load the hip joints, which would allow them to improve the mobility of them. So here we go. All right, so what you're gonna do is you're gonna go onto your hands and knees, and you're gonna spread your knees as far apart as you can. Now I want you to put your feet or toes down on the mat and then do the same thing. Widen out the knees with the toes on the mat and then sit down on to your heels. You should feel a stretching sensation kind of just along the hip here. You shouldn't be getting a lot of pinching sensation in the front. If you are, like I said previously, I highly recommend that you get evaluated by a clinical professional. So that is a hip opener exercise in the quadruped position. That's how you perform it. I recommend doing it to your tolerance and listen to your body. Don't be too aggressive at first because your hips are limited and it's been that way probably for quite some time. They may be all gummed up and stuck and you just need to free up that motion. So by doing the foam roll and then stretching, and this is a great loaded hip exercise to improve the flexibility of your hips. Now that you've already gone through the soft tissue work, the stretching, and now the loaded stretching for the hip, now it's time to go reassess. Go test your squat again. Film yourself again to see if and how effective the duration of your stretching time, meaning if you only stretched for a minute each exercise, let's see how effective that 1 minute exercise was, and then correlate that to your soreness. So you're gonna have to walk that little tightrope, if you will, trying to maximize mobility, minimize the soreness, but also see results at the end. So just as with strength training or any type of training, practice, practice, practice. It takes time to improve mobility. It takes time to improve a skill, all of that. So be patient with it, but just know that you now know how to assess the deep overhead squat, and if it's limiting your upper body, your hips, knees, or ankles, and now you have a few exercises or activities that you can do to help improve that area. So I hope this was very helpful for you. If it is, by all means, please like, share, comment, subscribe, all of that. I'd be more than happy to answer any questions you have. Stay tuned, guys and gals. I have a lot more coming and regarding the golf and body performance. So this concludes the series of 3 videos regarding the deep overhead squat. I hope you guys are all doing well and staying safe out there, and I'll see you next time.